Nobody likes a smart mouth, unless, of course, it has to do with how we take care of it. Dr. Grant Lemke at Cloud9 Dentistry in Heartland, Wisconsin says good oral health is, well, frankly, smart. Is there a link between your overall health and your dental health?
The most recent studies have shown, with conjunction with the American Heart Association, that the bacteria that are released into your bloodstream when your gums bleed also have an effect upon your internal organs.
How much can you tell in looking in a patient's mouth?
Well, you can see many conditions that go on. There are situations where people have a dry mouth, maybe due to radiation or chemotherapy that they've had. There's also indications of ulcers and different sort of red areas that indicate that there's bleeding and problems and people have not been keeping up with their nourishment. And there's obviously the decay that you see, that you know that somebody has been maybe eating the type of foods that will cause all sorts of difficulties with them being able to maintain their teeth.
But are there things that you can see in terms of this person may have heart disease or diabetes?
There is no one thing that you can point to on somebody's gums that say, you have diabetes, you're alcoholic, you're this, that, and the other thing. But you can see the breakdown of the strength of the gums and the health of everything when somebody's general health is compromised.
So with this link between your health and oral health, what types of things should a patient tell their dentist?
In our practice here at Cloud9, they have a medical history that they have to fill out. And what they list on there are all the drugs they're taking. And then what we do is we go online and check to see if there's any kind of oral manifestations of certain drugs. There's certain things that dry out the mouth. If your teeth dry out, it is really difficult to maintain them. So we have various chewing gums and different things that can be done in order to maintain the oral health's moisture so that those things don't happen.
How often should a patient really see their dentist to keep their best overall oral health?
It depends from person to person. We have, I say in general, people see us every 6 months because we can usually head off any problem that we can see. But then we have individuals who, for whatever reasons, maybe they have the gum disease around their teeth that we'd like to see them a little bit more frequently. So we'll have them come in every 3 months to have cleanings. They won't necessarily see me, but they'll see our hygienist. And then we even have people, we've had patients who are heavy smokers and they came in every month and had their teeth polished because they wanted to have them white and clean. And, it just varies. I don't think it should be anything longer than 6 months, but, some people do stay away for quite a few years, and then when they come in, problems that may have been small after 6 months have become a lot larger.
So your best advice to people out there about taking care of your teeth and taking care of your health?
Pain is usually the last sign of a problem, and in dentistry that's exactly the case. The problems start out small, and then when they become painful, they've usually reached a certain threshold. We do an oral cancer examination at every 6-month checkup. If you have oral cancer and it's small, and we get it taken care of, no problem. But if you wait too long, then it ends up becoming a massive problem. So in everything in life, again, just to check on it when it's small and get it taken care of when it's small is probably a better idea than waiting until the bitter end. And your options decrease as time goes by.
If you'd like more ideas on healthy living, we invite you to like Cloud9 Dentistry on Facebook. That's Cloud, the number 9, Dentistry.